So, Assalamu alaikum. Thank you for having BIMA on this briefing this morning. As Haroon mentioned, things have progressed since we last had this meeting, and unfortunately they have progressed in the way that we expected and predicted with regards to deaths increasing, more people getting unwell, and our services starting to become overwhelmed. The message that we really want to be getting across is that everyone's got a role to play. And I'm not going to keep this presentation too long because what we need to do is not particularly complicated. And the message essentially is to stay at home. We've got this message from the Prime Minister as well as the First Minister on the 23rd of March that we are under lockdown measures. We need to stay at home. We are only able to leave if we need to shop for basic necessities, and we need to keep these to a minimum. So only going when absolutely necessary. One form of exercise. We don't want people going crazy in the house, so we can get out, but only if we're staying 2 meters apart from each other, because we want you to get exercise, but we don't want you to share the virus and spread the virus and make the situation that much worse. You can leave if you're needing medical care, going to the pharmacy, or if NHS 111 or your GP has advised you to come to the practice. And you can travel to and from work only if the work can't be done from home, and only if it's an essential kind of profession or business that you are involved in. The most important thing being that we need to stay as 2 meters apart, because like I said, we do not want to be spreading infection. Situation is already bad. We don't want to make it any worse. Everyone's got a role to play. Everyone's got a role to play because everybody is at risk of the infection. The young, the middle-aged, the elderly, those with medical conditions, those with no medical conditions, particularly those over 60, those with long-term medical conditions, the pregnant, and people with a weakened immune system have a higher mortality rate. So those who are the people that are most at risk, but everyone is at risk, and everyone can spread the infection. So everyone's got a role to play. As Muslims and kind of a population with a South Asian background, we're at even higher risk, as we mentioned in the past as well, because of the significantly higher morbidity within our community. So in kind of lay terms, we have a higher percentage of patients with diabetes, heart disease, high blood pressure, and these are associated with people dying if they get COVID-19. We have a significantly elderly population, and alhamdulillah, we stay within our family kind of networks. We have close-knit families. We get together. Unfortunately, this is going to be working against us, because if we're living with the elderly, we can be spreading the infection to them. Our social nature is usually very good, but this will be spreading the infection. So that's why we need to be staying at home within our families. We need to be isolating ourselves. And really going against what we would normally do in our day-to-day life as South Asian Muslims in the UK. COVID-19 spreads very fast, and that's one of the big problems. It spreads via close contact, so this is the reason why we're saying stay 2 meters away from each other. It can spread even before anybody's got symptoms. On average, people get symptoms 5 to 6 days after they've actually got the infection, so they're going about their normal day, not really listening to the advice of staying 2 meters away, and for 6 days they're happily spreading the infection to people that they're coming into contact with, who then might have medical conditions and possibly could end up in hospital or die from it. So essentially, we need to be. This is how it spreads. That's why we need to make sure that we're not staying within that 2 meter distance. We're staying out with 2 meters from each other. And the other way it spreads is fomite spreads essentially on surfaces, and that's why there's a big drive for hand washing and cleaning surfaces, because the virus sits on surfaces through respiratory droplets, and so we need to be careful about that. This is some guidance in how long the virus can sit on surfaces. It's not absolute. There is still more evidence coming through. But this is to give you an idea that if you've touched a surface and you had the virus on your hand, or somebody coughed and the droplets fell on a surface, it can last on a surface from between a couple of hours to 5 days. You touch a surface, the virus could be there for the next 5 days unless cleaned. So a number of people could touch that surface for the next 5 days, and then they'll pass it on to others, spread it to other surfaces, spread it to other people, and that's what we need to avoid. So alhamdulillah, we, as part of Islam, cleanliness is half of our faith, and if we weren't already practicing it, we should be practicing it even more so now. But this is a kind of part of a poster that we presented, it's about a month ago now, but the advice is still the same in that essentially, and this is even more so the case when you're isolating at home, even if, so even at home, essentially avoiding spread of infection by coughing or sneezing into your elbow or into a tissue and throwing it away so that the respiratory droplets aren't in the air or on surfaces, not touching your eyes, nose or mouth. And when washing with soap for at least 20 seconds. And other things that we need to be avoiding, particularly when we're at home. This is probably going to be even more a case as with regards to sharing utensils, sharing cups, sharing towels. Normally that would be okay amongst family, there's no problem, but unfortunately at the moment we need to be trying to avoid that, because if anybody in your family has been out within the last 2 weeks, they could actually have the infection, but they don't have any symptoms. So they could be spreading it amongst the family. So avoid sharing things because you could be spreading the infection. So yeah, essentially it's kind of emphasizing that fact and the kind of guidance that's given in Islam anyway. So again, surfaces in the house, we need to be cleaning. The reason for the soap is because it helps break down the outer layer of the virus. So even though we think it's quite a simple agent, it works very, very well. Alcohol gel, if anybody can actually get hold of them, then we can use that instead. Clean our hands. And essentially one of the things that's important is that our houses, where we're staying, are well ventilated. If there's virus in the air, it can stay there for approximately 3 hours or so. If the rooms are ventilated, aired out, then it's the virus will be settling and going away. So essentially it's very important to keep the house ventilated and aired out, and avoid shaking material that could have the virus on it, that could actually make the virus airborne. What we need to be looking at doing is we need to make sure that we are essentially, we need to be protecting our vulnerable. So if there are people within our household who are elderly or have long-term medical conditions that are at high risk, essentially we need to be maintaining the 2 meters even within the house if possible. If you have symptoms, then no matter what age category or medical conditions you are, you have to be staying self-isolated. And essentially, it's not about being nice. You need to basically make sure that nobody's visiting you and there's strict hygiene and within the house with regards to cleaning surfaces, with regards to coughing, sneezing, with regards to being within 2 meters. If you have to be rude, you have to be rude. There's more important things at the moment, such as saving lives. Are we managing what what we're wanting to achieve? So things have progressed over the last week to 2 weeks, and everyone will have seen the curve on your left. Essentially, they keep talking about flattening the curve. So what they're saying, let's avoid the red and go for the blue curve. So what's happening is that the picture on your right is the current deaths in the UK over the last couple of weeks. And it doesn't take a statistician, mathematician to be able to have a look to see what kind of curve we're following at the moment. Two things I would say is, to me, it's looking at the moment like red, and at the moment it's looking like it's very early days. It's very early days, and we've got people that are young, 21-year-olds that have passed away. We've got elders that have passed away. I think in London, if I'm not mistaken, there was between 11 janazas in one day. I think there might have been more yesterday. I wasn't keeping up to date. We've got mothers, fathers, brothers, sisters that have passed away, and we've got Muslims on the front line who have passed away. So as Arun mentioned, Dr. Habib Zaidi, Mr. Adil Al-Tayyar, and a third as well, Mr. Amjad Al-Hawrani, have passed away in Al-June. May Allah grant them the highest level of paradise, forgive their sins, and give their family sabr at this difficult time. These healthcare professionals as well as other staff that are maintaining our essential services, putting their lives at risk, putting their families' lives at risk to provide us these essential services. We've got information from some places saying that there's not enough equipment to protect them, but they're still putting themselves at risk. And so essentially, the least that we can do is follow the advice and stop the spread of the infection. But is our public listening to it? We're still hoarding, we're still queuing outside supermarkets, we're still ordering takeaways. That's another thing I didn't mention, is that anything coming from outside into the house can have the virus on it. So essentially, what we're doing is we're putting our own lives at risk, we're putting other people's at risk, and we're disregarding the people that are trying to help the public with doing what we want and not following the advice. Unfortunately, I think we're at a kind of, I have no idea how else to put the message forward that we need to stay at home, we need to be making sure that we're isolating, we need to be making sure that we're keeping good cleanliness and social distancing. But you know, do you really think that you are going to starve to death, or is that pizza really worth it to put others' lives at risk? I'll leave that to for everyone to ponder. And if you do stay at home, then regard it as if you've saved a life. And if you do go out when it wasn't essential and you're not maintaining social distancing, then I would go as far as to say that you have potentially put people's life at risk, and there's a good chance that somebody might pass away because of your actions. So take that into consideration. Jazakallahu khairan.
Jazakallah khair, Dr. Sufian, for that presentation, really useful. We have a couple of questions, although not particularly, I don't think, related to your presentation, although there's one that's just come through which is relevant. So from Brother Shazad Hussain, on the point of exercise, many who are in the medical field advise not to go out as the virus is also airborne for at least 3 or 4 hours. Can you advise, as the government is advising advising herd immunity, and the medical field are advising something else, can you clarify, as he lives in a joint household, if his parents are vulnerable? And can you also advise about mental health signposting, which will come to actually with Spirited Minds, as advised in the media today?
Yeah, so a few questions there. So with regards to exercise, well, first of all, I mean, yes, the virus is in respiratory droplets. It is airborne for up to 3 to 4 hours, and that's why we're emphasising the importance of having ventilated areas, and that's why it's still allowed to go outdoors, because if somebody has coughed, sneezed further away from you, the virus droplets will have settled, and so essentially if you're outdoors, not near anybody, then the respiratory droplets will not be affecting you, so you can go outdoors, because essentially it's a very well ventilated area. So exercise is important as long as you're maintaining social distancing, so that is okay. With regards to, I mean, herd immunity is a different question in that they want healthy people to get infected so that they develop the immunity so that it doesn't spread the infection. It doesn't have anything to do with exercise. It's more with time, people we as a population will develop herd immunity to this strain of virus. Can you clarify? It's so what with regards to joint households, so essentially everyone's going to have their own specific circumstances. So if we're staying with people who are particularly vulnerable. So we've got categories, essentially over 70s, and then there's a list of certain medical conditions. And if you have those medical conditions, then they need to be self-isolating for up to 12 weeks. And yes, what you need to be looking at doing is that at the very least 2 meters distance from them, and trying to minimize the contact with them, making sure that we're keeping very good kind of hygiene measures, particularly cleaning surfaces, and surfaces, anything that they're touching, as well as emphasising that they need to be washing their hands as well before anything goes near their eyes, nose or mouth. And so, yeah, it's those categories we need to be making sure that we're isolating as best as possible, as well as anybody else kind of vulnerable.
So just another couple of questions that have come through.
Yeah.
Perhaps you could bat them off fairly quickly. Are face masks useful? Are gloves useful? And also, does using some sort of nasal spray or gargling, does that show any benefit to ward off the virus, or is that a myth? And can you also finally tell us if there's anything there to do with 2 meters not being enough of a distance?
So first two questions, no. Essentially, face masks for the general public, unless you're symptomatic, are not useful and can actually make things worse. So keep it simple. Healthcare people that are working with people with potential symptoms, yes, face masks, and there's different type of face masks that we should be using. But for the general public, no. Gargling, nasal washes, again, no evidence to say that there's any protection from the virus by doing so. And is 2 meters enough with regards to social distancing? Essentially, it depends on where you are. If you're in a closed environment, you're in a room with one other person and you're 3 meters away from them and they're coughing and sneezing, and then yes, 2 meters is not enough. But generally, as long as generally 2 meters is enough. I've not read the article about the 8 meters, so I'm not sure what that is pertaining to, but essentially it might be to do with the environment that the people are in.
So just the final question, I think, which is a useful one, just to clarify around takeaways. The brother in the group is saying that reports online say there's a very low risk of transmission from takeaways, but you're advising to be wary. What's the position here?
So I'll be wary of anything that's coming from out with. So that kind of slide that I showed earlier with regards to how long a virus can sit on surfaces. So if you imagine that there is somebody who was in the takeaway while your meal was getting made and was coughed or sneezed, or the person who's actually preparing has actually got the virus themselves, and they're touching that bag or they're touching that box that's got the food within, then that can spread the infection. And the same goes for shopping as well. Essentially, we just need to be careful with the food itself, because it's been heated over 60 degrees. Essentially, the virus shouldn't be on that, but the packaging is the problem. So essentially, we do need to be careful about that.
Dr. Wajid, if you can give it just a quick update as to where we are with guidance around the burial situation. There are also a couple of very questions around how effective bodies are after they passed away.
السلام عليكم جزاك الله خيرا الحمد لله رب العالمين والصلاة والسلام على أشرف الأنبياء والمرسلين نبينا محمد وعلى آله وصحبه وسلم ولله تسليما جميعا كثيرا. So I want to point out two things. The burial side of things is being dealt with by the National Burial Council, and I think they will be updating their guidelines and sending it out. They have a set of guidelines out there, but we have a situation right now, and the Muslim community is confused, and they have every right to be confused, where you have well-known, reputable scholars saying that absolutely you must not do ghusl. These people who die in a plague died as shaheed, and therefore they should be buried as a shaheed, and there should be no ghusl, they should be buried as is. Then you have other well-known, reputable scholars telling us that you must do ghusl, and that the obligation is not lifted. Now, I'm not a mufti or a scholar or a sheikh, and it's not for me to say on the fiqh opinion, but this situation is simply unacceptable for the Muslim community in general, because we are trapped between these opinions. And this is, I'm afraid we keep finding ourselves in this situation where we get trapped between these opinions who are diametrically sound opposed, and the community, it adds to stress and confusion in a time that we really don't need any more of this. So if I sound annoyed, it's because it is an annoying situation to be in. So as the area we can talk about is the medical side. And the medical side is to say that there is also confusion on the medical side. There's some medical bodies, Public Health England, the World Health Organization, that say it's fine, go ahead. And there's some bodies that are outside the UK, from whether it's Italy, whether it's Singapore, whether it's Malaysia, whether it's the Islamic Circle North America, who are they're saying the opposite. So again, in the medical side, you have the same issue. You've got this confusion, and again, the public is confused, and it's highly annoying. And what I'm trying to get at here, brothers and sisters, is that actually what we don't want is a yes or no answer. What we need as a community is to say that what are the steps needed to make sure that if you do ghusl, do you need these steps in place? If you don't do ghusl, you need these steps in place. Can the body transmit infection? It's a low risk. An infection is transmitted through aerosol spray. The risk of transmitting the infection is low from a deceased body, but low risk is not the same as no risk. Low is relative. If the risk of transmission of infection is 50%, for example, with a living person, it might be 5% with a deceased person. It's still there. The infection can live on inert surfaces like cardboard for 24 hours. So it stands to reason that it can also live, if it's been aerosolized onto a body, it can live there for a length of time. It also lives on fomites, which are areas which they particularly like, for longer. And hair and nails are particularly places that they can live on for longer. It's also transmitted by feces. And this is an area that's closed, that's washed in ghusl. So again, it can be transmitted that way. So as the British Islamic Medical Association, our job is just to tell the community that our job is not to tell which way to go. This is for the scholars to determine, and each scholar for different communities will determine that. Our job is just to take the advice that's out there and to make it relevant to the Muslim community, and that is to say, there is risk from the dead body, but it's lower than from a non-dead body. Number two, there are certain things that you do when you do ghusl, if you will go do ghusl, that will make it high risk, like using a spray on the body. This will make a low risk procedure into a high risk procedure, or the back passage area is a high risk area as well. Number three, it's about putting on and taking off the personal protective equipment, how you making sure you have the right amount and that you wear in the correct way and that you remove it. So for example, there were some people who were saying that we're going to wash ours and reuse it, which doesn't make sense because it's a single-use equipment. So our advice right now, we're going to come out with some graphics for the Muslim community, but our advice right now is that whichever way you follow, the ghusl way, which is of course the opinion that all scholars agree is that's the preferred method, if possible, or the non-ghusl way, make sure that you consider that what are the practical and medical steps that you need to take to stay safe in either scenario. That's our advice right now.
Okay, Jazakallah khair, Dr. Wajid. I know it's a very fraught area, and I think you're handling it very well. Explain that very clearly indeed. So just to be absolutely clear, you're saying there is going to be something coming out from the National Burial Council, hopefully soon, in terms of a revision of guidance. So I know there are people in the chat box at the moment saying that we need guidance. So just to clarify once again, there is already guidance out there from the National Burial Council, but that will be revised and updated and sent out again soon, inshallah.
Yes, and there will be separate advice from BIMA, from the British Islamic Medical Association, about the medical aspects about this. A lot of people need to understand something. The advice, unfortunately, and I don't say this often, unfortunately, a lot of the advice that you get from the authorities, you have to take it with a pinch of salt right now, because no one can be an authority on a disease that they didn't see coming 2 months ago and that is evolving rapidly. You can see that people are making U-turns all the time. So they're sending, staff to the front line without the correct equipment. Sometimes it's not because it's safe, go and see patients without a visor or without a proper respirator. It's because they don't have it. So what are they going to say? Leave the patients to die in the hospital? So similarly, what we're doing is we're providing the advice to say, this is the advice specific to our community, specific to ghusl, specific to where the ghusl normally takes place. And the BIMA will be publishing that hopefully in the within the 24 hours, inshallah.